Well, UIndy has announced a new partnership with Community Health Network. The result will be a new primary care and research center where students will train next to experienced practitioners. Barbara Lewis has more in the business of health. Barbara.
Well, Gary, thank you very much. Well, the University of Indianapolis will open a health pavilion providing primary care and physical rehab and therapy. Joining me to talk about this partnership is Rob Manuel, President of the University of Indianapolis, and Brian Mills, CEO of Community Health Network. And it's great to have you both here.
Thanks for having us.
Thank you.
So, Rob, I want to start with you. What is the vision for this program?
So the vision starts from a series of conversations we had on our campus to think about how we connect the academic enterprise of our institution with the corporate, the for-profit, the nonprofit, and the places where our students will be employed when they leave. And so when we think about half of our enrollments, which are in the allied health areas, we thought a partnership with a progressive, innovative hospital partner system would be important for us to train and educate our kids with. And that was the journal of it.
And I think it's easy to imagine, wow, this is a benefit for students to be trained for jobs. But Brian, what's the benefit for Community Health Network?
Well, there's two benefits. One, to partner on how we provide services to help the health and well-being of the community. You know, we both have similar missions, and we're trying to do things in a part of town that needs some attention. And we're going to bring investment here, and with that, expand our mission. As it pertains to the students, healthcare is changing. And I know everybody knows that, but the jobs required and the competencies of the jobs. And so therefore, and we see it's still expanding. And so for us to engage and immerse ourselves in the education and try to help amplify a student's understanding of what the expectations are going to be helps us as well. So we're delighted to be a part of this with Rob and his organization, especially most people don't realize how much of UIndy is health sciences.
Yeah, well, half, that was surprising. So what are you going to ask the students really to do? I mean, what are the opportunities that they will receive?
So first, they're going to be trained in an interdisciplinary world. So as Brian said, the healthcare is changing. A person comes in with a lot of different issues, comorbidity issues that need to be dealt with. And rather than dealing with one and then passing the person down the production line, we're pulling all of those healthcare providers in together to assess and analyze and help and provide coaching for general health and wellness as they move forward. That's a fundamental shift from how we've trained students in the past. And then they've had to be trained and educated on how to work inside of the health or the hospital system that they were employed in when they left. So they're getting that training ahead of time, and then they'll be quicker and better able to adapt to the professional setting that they take upon graduation.
Okay, so you will have actually a workforce. You will be training your own workforce in some ways, Brian, right?
We'll be training a workforce. I mean, hopefully some of it will be ours, but it's not exclusive.
You'll share?
Any means. We will share. But you know, the operation there will literally be a department of our organization. And we can do training, but we can also see other patients. And we can also provide services to the community at large.
Right. And for Community Health Network, this is part of the South Campus?
Part of our South region. We have a hospital just south of UIndy. And we divide our organization by regions because our populations are very different, even within the city. So this is clearly within our South region, fits within what we're trying to do there. And so we try to make sure that the experience that these students have will be throughout that region.
Okay, and it sounds like physical therapy, rehab is a very important component of this one.
Physical therapy, occupational therapy, psychological services, the general practitioner work that we would have in there, social work, medical social work, all of nursing, all of those are included in the building and the relationship that we're forming.
Well, Rob Manuel and Brian Mills, it's great to have you on our program. Thank you so much.
Thank
Always
you.
a pleasure.
Gary, back to you.